Gotta show the people the shirt.
Nice.
You see it?
Nice. I love that.
Gonna stir up some, gonna trigger some people.
Oh
But
no,
hey,
nobody getting triggered here. I talk about that all the time. How if you, yeah, we talk about.
no, not with you guys, but like out on the streets.
Oh sure. Hey guys, hey guys, we are live, and yeah, I was just sitting here talking with John, set up, and he was showing off his shirt. Do you want to show it off again?
Yeah, get in the view. I don't know if it's weird because of
No,
the little
it's
square.
yeah, you
It's
can see
right
it.
there. Okay,
Yeah,
cool.
yeah.
Yeah, it's a vegan
Yeah,
shirt that I would rep. I wouldn't rep them all, but I like this one.
no, that's a great one, and it's a good policy to go by. Yeah, I was just
Absolutely, you got to trigger people for the animals, make them think.
yeah, yeah, because it's like, I mean, it doesn't matter which way you break it down, whether it's from a moral perspective, it's wrong. From a physiological, logical perspective, it's wrong. It doesn't fit with us. We can't digest it. So it doesn't matter which way you slice it. It just
Yeah,
doesn't fit with us. So as long as people want to keep living in the lie, that's what keeps us rooted in the sort of lower carnal chakras where we're supposed to rise. We're supposed to elevate past this stage, but some people really get stuck in those lower stages and they just want to stay there. And I can't speak with a lot of judgments because I was there. I know what it's like to be rooted in that space. But once you
totally.
realize, once you know better, you do better. And that's the way we got to be.
That's a fact. Yeah, that's what I love about my job is that I can get people to go vegan. Maybe not for the animals, but the diet that I push for regeneration and to heal yourself is the vegan diet. So it all works out
Yeah.
perfect.
And then it just makes sense from there. Yeah. So yeah, thank you guys for tuning in. This will be I'm really excited about getting this started up. So this will be a first and hopefully a series where we're gonna have John and his infinite wisdom in iridology to come in and show us show us how it's done, show us how we can take a look and take a look at the eyes and really get such a good grasp over our health. It's arguably the best way to get a snapshot view of the holistic health. So with that, I'll pass it over to John for just a little bit of introduction on yourself and iridology in general.
Yeah. So how I got started with it was I just started experimenting with it because the doctor that I was following at the time, the naturopath doctor, Robert Morse, he did a lot of demonstrations on YouTube, and it interests me. I'm like, that's a good way to write herbal protocols because I already had an interest to become a detoxification specialist, and I knew that the herbs worked really great for me. So as he was kind of showing me how to do it, it really sparked my interest to read the books, Bernard Jensen books on iridology, and then pretty much I think any good iridologist becomes a good iridologist by simply just experimenting. And so I started doing that. People were like, hey, do you do iridology? I know that you know all about Robert Morse's work, you have experience. And I'm like, sure, let's try it out, and I just got busy reading books and, kind of messaging other iridologists and seeing kind of like the simplicity of how to do it. And once I grasped that concept, I just started experimenting, and people were telling me, wow, how did you know about this? I'm like, I don't know. I'm just learning this simple science right here with this chart, and I just happen to know about the body, how I've been taught through Robert Morse, and it just seems to come together real nice. And so at that point I knew, okay, I want to do this for a living, and I got certified, and that's that whole thing. But just to break down iridology in the simplest way possible, pretty much what I see is I see the eye, and it shows me shapes, patterns, colors, and different variations to help distinguish, weakness in tissue, whether that's congestion or whether that's genetic. The eye it has trabeculas, and those trabeculas, show those stages of weakness in the eye. And it's pretty much what I do is I just map out the eye. I look at it from head to toe and signify that the stages of weakness in the eye, and then I set it up for obviously we got to build a foundation, which is going to be the diet. That's what's going to really help the body to detoxify. But I'll know for the individual what kind of herbal protocol to write for them, because maybe somebody might not have a liver problem. So it'd still be good to clean your liver on a detox with the herbs, but I know for sure that person would need a liver formula, but somebody else may not need one. You know, maybe it's not as important for them. So I use it specifically for that, to write herbal protocols, but it's also a great motivational tool as well. Let's say you don't want to do the herbs or whatever your personal beliefs are regarding herbs. You don't have to. It'll just be a good motivational tool to help you understand what's going on, especially if you resonate with what's being said, to kind of, you know, catapult you in the right direction to go after your health. So I don't know if that answered your question, but
Yeah, no, that's fantastic. And yeah, I mean, that's a great summary. So what we're going to do here, if y'all didn't see my post, is each show we take eye photos submitted from you guys, from anyone who wants to have their eyes looked at. And just a note, if you are submitting photos, just make sure you're comfortable having your health kind of examined live on the air, because this is a pretty in-depth look at your health, and we are going to ask questions and go over it. So don't send photos if you're uncomfortable with that. But those of you who are okay with that and send in your photos, we're going to go over them here. And John's basically going to break down and give a snapshot view of what an iridology examination would be like. So John does this on a regular basis with clients. He does full on reports. So what you get here is definitely a lot less, much less than what you'd get in a full on report. But this will give you a good snapshot idea of what iridology is like and what sort of things we can uncover. And we'll have live examples to kind of go over each one. So with that, I'll start sharing my screen and we'll just jump right in. You ready to get started?
let's do it.
All right. So Aaron, you are first up. So we'll go ahead and pop yours up on the screen. You want to start with his...
Yeah, pop that up on the screen. We'll zoom in on it, and then I'll look at it from my phone as well.
Yeah, so this is going to be his right eye. We'll start with.
Okay. Okay, you just kind of zoom in on that just to have it ready, and I'll break it down from my phone. It's zoomed in real nice, because on my side it's not yet. Maybe
Okay.
I can do it. I think when I do it, yeah, see, I'm doing it right now. I don't know if that's showing anything on the screen, but it's definitely working for me when I do it.
No, it's not zooming for me. So
I'm good though, at
okay.
least to kind of draw on it, but for the
Okay.
viewers, yeah.
Yeah, for the viewers, I want to make sure the mouse lines up is the only thing. So
Right.
I'm zooming back out. So it's not changing at all for you?
It's just not zoomed in enough. Okay, it's zooming in better, but not like enough to really see it good for me.
Okay.
But I could do it though. As long as the screen shows it's really nice. Okay, right there is good. Yeah.
Yeah, let me just go on to...
Perfect. Don't zoom in anymore. That'll be perfect right there.
Okay. Okay. Yeah, I'm just looking on my phone to make sure it's all showing up correctly. All right.
All right. So first thing, what I do as an iridologist is that I look at the eye to verify how the genetics and constitution are. So genetics, to kind of simplify it in layman's terms, you know, as it pertains to what I do, you know, for detoxification, it would mean that somebody's body could really withstand a lot of damage before it fully goes out on them. Or also it could mean that the person could reverse the damage much quicker because the genetics are stronger. The cells in the tissue happen to be strong, but that doesn't mean that there's not a lot of waste compromising the cells. that's the constitution as well. So what I do is I either state whether they're poor, fair, good, great, and excellent. Now, with my personal opinion on this eye, I would say that it's in the good. So not great or not excellent, but I don't think that matters too much. At least they're good. That's a good thing. All right, so right off the bat, what I try to do is I try to go, okay, how do I start this off? What do I want to state first? What's standing out to me mostly? And so in this eye, so first I have to say whether it's the stages of lymphatic congestion. So the lymphatic system is 80% interstitial fluid that goes all throughout the body. It's your sewer system. So it's responsible for draining cellular waste. So overall, from head to toe, when I look at this eye, which is a genetic blue eye, in the stages of acute, subacute, and that's from least to worst. Acute, subacute, chronic, degenerative. This eye is going to be in the beginning stage overall throughout the body as an acute stage, which is a good sign. You don't want to be in subacute, you don't want to be in chronic, you definitely don't want to be in the degenerative stages regarding your lymphatic system, because that would signify that you're not draining acids out of your body, and that's why you're suffering with health problems. But for somebody like this, they may not have a lot of serious health problems. I'll never know, but one thing that stands out to me first is if you look at the pupil. So let me see what I can do here. This is our first time here, so be patient with us, guys. All right, so do you see where this arrow is?
Yeah.
Now, if you were to go around the entire pupil in a circle, you see how it's like a rope? This whole thing is a rope, and it's very thick. I don't know how I could, right here, it's very thick bow wall. And that thickness is indicating, let's zoom it out.
Yeah, you just zoomed out.
I'm not trying to, it just did it on its own.
Here, I'll zoom back in for you.
Anyways, yeah, so that thick rope around the pupil means that this person has a lot of mucus and congestion in the bowels. So, it could be possible that small bowel is really clogged up. I'm seeing somewhat of a malabsorption ring. So we call it a malabsorption ring on the pupil, where there's either a dark shade around the pupil, whether it's black or brown or gray. There's all different types of colors. In this one, I do see it. It would be hard for me to show you guys what I'm looking for, but maybe I can with this arrow. So right here, you see how it's off shade black around that pupil? It's darker, right? I know that there's light reflection, but still, as an iridologist, I could tell that dark off shade color around the pupil means this person has a lot of mucoid plaque in the body, and their small bowel isn't absorbing properly. So there needs to be a lot of cleaning going on in the small bowel so that this person can get better nutrient absorption. So during a detox, this person might lose a lot of weight until they clean out the small bowel so that they can get better absorption and then rebuild their body properly. So the first thing that I'm noticing is that this person maybe, I'm only looking at the right eye, is most likely dealing with a lot of bowel related issues. So one thing I do see too, it's going nuts now. Let's take it on the outside here. Now, if you see on the outside of the iris, which the white part is the sclera part of the eye, you see that there's this color showing on the top, right? We call it a violet hue. And violet hues indicate blood circulation problems, meaning that your blood is getting clogged up, especially in the head area, because I don't really see that around the entire iris. I see it more in the head. So this person quite possibly might not be getting a lot of circulation to the brain. But if you get on a raw food diet, that'll help bring oxygen and to the blood and clean it out real nice, improve the circulation before that, because then, whenever there's a violet hue forming, the next step would be what we call a cholesterol ring. And that cholesterol ring will start to form around the pupil, which will look like a white color. And that means, elevated cholesterol is systemic acidosis. Somebody can't have elevated cholesterol if their body's alkaline. So it would just simply mean that the body's very acidic and needs to drain. Okay, so one thing I see is parathyroid and thyroid weakness. Now let's see what I could do here. You see that where the arrow is? Mm-hmm. Justin, do you see that?
Yeah.
Okay, you see how it's like a rectangle, right? It's like this circular rectangle. We call those lacunas. And lacunas, they indicate genetic weakness. Now, right where that arrow is, you see that white color, right? You see the thickness. That's lymph stagnation in these tissues. That thick white look, it means that not only is there genetic weakness, because we see that oval look, the lacuna, it's genetically weak. So genetically weak, and there's a lot of lymph stagnation. The parathyroid, which is going to be right here, that's where the parathyroid is, and then outside is the thyroid. And so the parathyroid is responsible for utilizing calcium. So if somebody's not utilizing calcium well and they're not eliminating well, then their body's most likely going to try to rob calcium from the body to neutralize acid, because the body's trying to always protect itself if it's not draining properly. And calcium's an antacid, so the body likes to steal calcium there. So, but the lymph system in the parathyroid itself is being compromised, or else it wouldn't be genetically weak. So this person had a genetic weak parathyroid and thyroid gland, most likely from conception. They got it from their mom or their dad. So what I would, so in this case, I would definitely want to recommend on a detox, a bone and connective tissue formula, and quite possibly a thyroid herbal formula. But if somebody has a hyperactive thyroid, I'm definitely not going to want to stimulate the thyroid with herbs, because the herbs will stimulate it. The thyroid herbs are really to help somebody with a hypothyroid, a low functioning, kind of get it to act, bring some activity to that tissue. So this person quite possibly might have varicose veins. I mean, in men, it's not common, but men do get them. Spider veins, herniations, prolapsing of any kind of tissues. History of depression is very common for those that don't utilize calcium properly. Brittle fingernails. Maybe if there's anybody in the family that has had, God forbid, but brain aneurysms. Aneurysms are connective tissue weakness. So that could be a sign there. Maybe this person doesn't sweat properly. They might have cold hands and feet. They may have, slow oxidizers, meaning that it takes some time to metabolize food. So they have a slow metabolism, or somebody that has a quick metabolism. Either way, whether that genetic weakness is there, we could fix it. We can go after the kidneys. So let me go to the kidneys. Well, yeah, it'd be good to go to the kidneys, because I definitely see that in this eye. So right here, we're going down to the kidneys and adrenal glands. The top of that, right here, oh, come on, you silly mouse, is the adrenal. And then down here, down below, is the kidney. So that's right there in my chart. I'm seeing it, that big lacuna. So I'm going to say that's subacute genetic weakness. Sorry, I didn't mention the parathyroid and thyroid. I'm also going to say that's strong acute, not quite in the subacute, based on the color that I'm seeing. This one, it's a little darker, as you could tell.
Can you go over the scale one more time of the subacute, acute, like what?
Yeah, so
what that means?
Acute being the least, subacute being more advanced, chronic is real advanced, and then degenerative is like somebody that could quite possibly have cancer or something like that.
Right. Okay.
But I can't say that on YouTube, right? Oh well. All right. So that's definitely a big lacuna right there. See that big pool looking thing?
So that when you say lacuna, you mean like the darker spot, right?
Right. Exactly. It's like an oval. It's like a circle or an oval.
Yeah.
Those We call those lacunas, which mean genetic weakness.
Okay.
But that you don't want to be genetically weak in the right or in the kidneys and adrenal glands, because your kidneys are what's going to help drain the acids and metabolic waste in the thyroid and parathyroid that we just looked at, right? So in order to fix that, you got to go after those. You got to go after the kidneys. My hands are sticking to my tablet. So we got to bump up those kidneys. So seeing that there's genetic weakness there, if somebody were to come to me and want an herbal protocol, well, for anybody, I'm going to recommend kidney and adrenals, no matter what, genetic or not. But this person might need, if they want to really go after their body and strengthen these tissues, then, maybe 60 days might not be enough. So they may need to stay on them longer because there's genetic weakness. They've been living with this weakness their whole life. They inherited it. And anybody with genetic weak kidneys, I'm going to say, well, let's double up the kidney herbs. Let's do 2 formulas, maybe 3, depending on, other factors that information that I would get from the person. So the kidneys are responsible. They're the door. They're what drain the septic tank. Look at the lymphatic system as a giant septic tank in your body, and your lymph node, or the lymph nodes are little septic tanks, and the lymphatic system is like your main sewer system. Well, you have to drain the sewer system, right? What comes in must come out. And your kidneys, what they do is they filter out not only all the cellular waste, but they're supposed to, filter out through urination all the waste that we put in our body if we're not eating healthy food. So this person might have kidney filtration problems. They might have also adrenal gland problems. Your adrenal glands are responsible for neurotransmitting hormones and steroids, mineral utilization, sugar metabolism, your sexual hormones, your gonadal hormones like testosterone, progesterone, estrogen, that type of thing. So if somebody with adrenal weakness might have those types of weakness, maybe have really chronic fatigue, because their blood pressure is very low. They have maybe anxiety, might have asthma, shortness of breath, irritable bowel, that sort of thing. So subacute weakness in the right kidney and adrenal. All right, let's go. I should probably go back up here, just so I can kind of go down and work my way down. I just wanted to go to that kidney because I saw it there, and I wanted to explain that if you want to fix the parathyroid or any tissue in the body, you always focus on the kidneys and adrenals, and that'll help strengthen tissue no matter where it is.
Yeah, and anyone listening to Dr. Morse or yourself for more than just a few times know how repetitive that gets, because it's so important. The kidneys and adrenals, we have to focus on those first, or we're just going to be backing up everything else. We're not going to be draining properly.
Exactly. So I'm going to go right inside here. So here's the bowel wall, that rope that goes around. I'm going to go inside, and that's where the stomach area is. So this is the stomach, right in this area, all around the pupil. Do you see those? You see those little dots right here?
Mm-hmm. Yeah.
You see them up as well. Those are bowel pockets, and those are right in the small bowel area, because this is a right eye. It better be a right eye.
Yeah.
So that's connective tissue loss. So any kind of bowel pocketing that takes place, there's these little pockets, because inside the wall of the colon is being compromised. Well, what's compromising interstitial spaces inside the wall of tissue? Acids. That's the side of chemistry that is causing all of our problems. And so if there's too much acid in the colon, and let's say the appendix is down and all the lymph nodes aren't draining and liquefying all this hardened lymph waste, and the kidneys right here, because we see are genetically weak, then inside the bowel wall doesn't get drained. So over time, it starts to steal calcium from connective tissue in the colon. So this person quite possibly might have some colon issues, but I'm definitely seeing bowel pockets. So we definitely want to address that. Let's go upstairs real quick right here. I see a lacuna. Let's kind of map that out on my chart just so that I get it properly. Here, let me look at my phone. That'll be better. So that is right in the esophagus area. Yeah, it's right in the throat. So the throat, the vocal cords, trachea, esophagus, the bronchius as well. And so that's a dark color right there. So I'm going to say chronic because it's black, right? So that little tiny lacuna right there is black, meaning that this person might have sore throats, maybe have strep throat, any kind of, esophagus and throat type of issues. During a detox, this person most likely is going to have a sore throat, a healing event while they're correcting the problem. So I want to point that out. Now down below, we also see one right here.
Mm-hmm.
Come on, Arrow, get right on there. There we go. And that's going to be more on the scapula area. So the upper spine, like right, behind your shoulders, the upper back, I'm seeing some weakness. So maybe this person feels stiff, in the upper back in the scapula area. They might have some cramping going on. It's possible. Okay, let's work our way down. Because I'm seeing these lacunas. You guys see these lacunas everywhere,
Mm-hmm.
which means that these are genetic weaknesses. That's more in the mid back now. And then we go down and we have the lower back, so all those shapes right there are telling me this person has spinal issues, whether they feel it or not. If you take away stimulants, you might feel it during a detox, to know that this is what's going on. So again, seeing that parathyroid and also seeing spinal related issues here, they're going to want to, really strengthen that with bony connective tissue herbs. All right, let's go down. I'm seeing right here. That's more in the groin, hip, femur area. Quite possibly this person has right leg weakness as well. We're going to go up right here. See that?
Mm-hmm.
Come on, John. I want it right on the button.
Right in that little dark spot.
Yeah, my hands just keep sticking.
I can help you get there.
Yeah, get right there in that dark spot. You see it. That's the pancreas. So I'm going to say, because it's really small, I'm going to say it's subacute. Not quite chronic. You know what? Hold on real quick. Let me look on my phone to get a better look, because I'm very close to the chart right now. That's the appendix, not the pancreas. That's the appendix. It's right. It's closer in the appendix area. So this person might have appendicitis, or maybe they had their appendix removed. A lot of people do get their appendix removed because doctors tell you that it's, oh, there's no use for your appendix. Nature made a mistake. But the appendix is not only it's a giant lymph node, and lymph nodes are responsible for draining certain tissues. It's connected to your lymphatic system.
We can ask Aaron. Are you still in the chat? Did you get your appendix removed? Might take a second. There's a delay on YouTube, so you can keep going while he responds.
Okay, and so you don't ever want to remove your appendix, because that's responsible for draining to break down the waste matter so that your kidneys can filter out this waste. And it's also, it's a big lymph node, but that, collects a lot of bacteria. And I don't know for sure, but the more beneficial bacteria you have in the colon, and if your adrenals are working properly, then, you're gonna utilize and absorb B12 better. And so that's a big house for bacteria. And if that's been compromised, then it's quite possible that there could be a connection with low B12. I've been trying to figure this out just from doing iridology readings with a lot of people, because I'm like, well, bacteria in the colon is really helpful to facilitate B12 in the body, because B12 is a bacteria.
He said no. He still has his appendix.
Okay, well, that's good. Keep it.
Yeah.
Just don't. It's quite possible if, let's say, Aaron went off and started, abusing his body with acids and eating poorly and whatever. It could compromise that appendix to where, and you'll feel it. You'll feel your appendix bursting on you. So you definitely, I mean, as long as you're on an alkaline diet and you're going after your lymphatic system and you're focusing on getting those kidneys filtering, then all these things that show up in the eye will improve with time. But you don't want to remove your appendix but anyways, I was going back to, it seems that those that have given me their background that I see that appendix weakness also seem to have low B12. So I don't know, there might be a connection there. I'm pretty observant with that kind of stuff. All right, so right here where the arrow is, that there's another, football looking shape, right?
Mm-hmm.
And that football looking shape is right on the gallbladder. Now, right here, you see that white line?
Yeah.
That's a trabecula. That's, so those fibers that look puffy like that in the iris, that's lymph stagnation on the pancreas. So the pancreas is designed, its main role is to help you digest your carbohydrates. So if there's lymph stagnation there, it's possible that this person has gas, bloat, maybe undigested foods in their stools. Acid reflux could be also a symptom of not producing enough bicarbonate from the pancreas to neutralize and digest enzymes as well. So there's definitely lymph stagnation there. So you'd want to strengthen the pancreas. You could use herbs, but of course the diet's the foundation, the fruit diet, raw foods. So right where the arrow's at, that is showing me subacute genetic weakness in the gallbladder. And I'm going to say liver too, because right below, there's a lot of thick white looking color, and that's mucus. They call it fatty liver and that sort of thing when the lymph system backs up in the liver, and fats are just there to kind of protect the tissue. But the gallbladder's main role is to produce bile to emulsify and break down fatty acids. So definitely, if somebody with gallbladder problems, you want to stay clear of rancid fats. Anybody wants to stay clear. I mean, everybody stay clear of rancid fats and fat in general, overt fats. But you're going to do better on a low-fat diet, which I promote a low-fat plant-based diet, focusing on the fruit and the raw foods. So we're seeing that. Also, I want to say, now that I'm talking about this, is you see this white color in this eye. You see that cloudy white color, especially over here in the head area.
Mm-hmm.
This is the head. This whole area right here is the head. And you see all this thick white looking color? That's a lot of mucus and waste backing up in the head area. And a big reason for that is this right here. You see how puffy that cloud is on that? That's the transverse colon area. So when that transverse colon gets clogged up, the head gets clogged up, because you have to really, once the bowels move and clean properly, then the head can drain with it. So there's a lot of mucus in the sinuses and in the head area, maybe clogging in the ears, maybe some vertigo issues. We'll get to the other eye to see the cerebellum. I could go on for hours, guys. Sorry about that.
Oh, it's all good. I mean, people are loving it. Aaron asked, how long does it take for the eyes to show change once one starts a detox?
The eye color starts to change. Well, that's going to be determined on how well you eliminate waste out of the body. So if your kidneys are filtering and you're doing everything to make sure those bowels are moving while you get rid of the acid and mucus forming foods, and you adopt a mucusless diet lifestyle, then as long as you're seeing that over time, you should see that take place. But it's all going to be depending on the individual and how effective they detox. Are we here?
Are we here?
Oh, I thought it froze out. You're good at not blinking.
Yeah. Are you hearing an echo or any feedback on your end? Someone in the chat was okay.
No, it sounds fine.
Okay.
So for me personally, going on just fruit and green juices, or just fruit and doing intermittent dry fasting daily and that sort of thing. And I got my kidneys filtering, and I made sure that if I needed enemas and herbs to help really pull and break up the bowel wall and pull out the sludge and mucoid plaque, I saw changes in 3 months. But some people, it's either they're not disciplined enough with the diet, and they're not, a lot of people have a lot of fear around detox. That's another issue. But again, I don't want to go on a tangent there. But as long as your kidneys are filtering good, you should see those eyes starting to look clear. You want your eyes to glisten like a blue marble. You know, you don't want that cloudy look in there, because that cloudy white look is a lot of mucus. It's quite possibly that Aaron grew up on dairy products. I mean, most of us have. I wouldn't say that it's a dairy farmer looking eye. I mean, if somebody were to, a dairy farmer were to send me their blue eyes, it would probably look all white, you know. Still got a lot of work to do to clean out that. So I can't really tell, you know, there's people out there that are like, I promise you, you'll get well in 3 months and you'll have all these. It's all individual. It's all based on what you're doing, how effectively you're detoxing. And if you guys need a detox coach to help you get those results, you know, I've got a lot of experience to help you so that you can start seeing those changes in your eyes. All right, so let's go back down in this area, because this is where we stopped. So doing my best here, guys, on this video. When I don't have any distractions, I have my chart in my phone and I'm putting together a written report. It's much easier.
You're doing great. I mean, this is very informative. People are loving and all the information.
Cool. Glad to hear that. So right in this area is like in the bronchioles, in the ribs, in the right chest area. I'm seeing some genetic weakness in there. I'm going to say it's acute stage. But also upstairs, I'm seeing like right here. See all that white color? That's all in the chest as well. And up here in the lungs, a thick white, milky looking color. But then right here, I'm seeing a little lacuna again. So what is that? That's genetic weakness. And I'm going to say that's genetic weakness right there in the right lungs. So right in like, not in the mid, but the lower lung area. It really doesn't matter. What matters is that your lungs aren't as strong, or else that wouldn't pop up. So there's herbs to help really strengthen the lungs and pull mucus out of the lungs as well. I mean, you might, you know, get a lot of, you know, expectoration of mucus on a proper detox. So what's cool about iridology is I could say these things, and then if they happen, they can kind of calm a person's nerves. It's like, okay, I was told this was going to happen, so I'm not. It's nothing's wrong. Because a lot of people during these healing crisis, which I don't like to call them that, I like to call them healing events. You know, if you're having a healing event and it's uncomfortable, and you're kind of prepared for it, then it could help kind of calm your nerves so that you don't think something's going that's wrong. Because a lot of people mistake that. Well, I should be getting better. Why do I feel worse? Well, sometimes you feel worse before you get better, because acid's out.
Yeah, we talk about that a lot, where people, you just have to have faith that the fruit is going to heal you. So whatever you go through, it's something you need to go through and to work through to sort of get onto the other side. And that's where the true health is met. But a lot of people will go on a fruit diet expecting it to be done overnight. And then they experience these uncomfortable symptoms and they think the fruit was the thing that caused them the problem, and they fall back to whatever else. So it's really important to remember that.
Yeah, that's a fact, brother. Thank you for emphasizing that. So right here where the arrow is, you see that? See that dark line?
Yep.
That's right in the shoulder area. So it's possible this person has a right shoulder weakness. And again, you know, it's acid stagnation. All inflammation is acid stagnation. It could be an injury too. Sometimes if I see these things in the shoulder area, because I know that the shoulder is a really common area to kind of injure yourself. There could be an injury there. Maybe Aaron doesn't, oh, my shoulder feels fine. But on a detox, you might feel it. You might feel that right shoulder if you don't already feel it now. You want to ask him?
Yeah, Aaron, you got anything right shoulder wise, either past injury or you feel any discomfort in that area? Yeah, there's always a delay between the.
All right, we'll go up right here. I just want to see right here. You see this line right here that goes straight up? That's lymph stagnation right there. That's lymph stagnation right here. Can you see me? I just want to make sure. So right here is the mastoid. That's your right mastoid. Now there's a lot of lymph in there. So, you know, it might have some ringing in the ears right here. Tinnitus, a lot of the times it's because there's lymph stagnation in the mastoid. So I'm seeing not only lymph stagnation in that tissue where that puppy trabecula look, but also right next to it, we see another little lacuna, and it's dark. And that's could be in the medulla. So the medulla and the mastoid are looking somewhat compromised. Nothing serious. This person doesn't have a lot of serious endocrine issues. I'm happy to see right here. I don't see a lot of, this is where the pituitary gland is. That's your most important gland, because the pituitary gland is responsible for, it's your overseer, it's your boss, you know, the employees go to the boss every day and they go, what's on the schedule today? What do I got to do? That's what that gland is for. It sends instructions to all the other glands, produce hormones and steroids at this time of the day or whatever, when you're consuming and stuff. So if that's down, then all your endocrines are compromised. So seeing that right here, he has a strong genetics in his pituitary is a great advantage.
Nice. He did say he broke his collarbone when he was a kid.
Okay, that's exactly where it is then. So it's the eyes will show up these injuries. So right back here, that's what that is. That big dark line is that shoulder, is that injury.
That's wild.
Pretty crazy, huh?
Yeah.
Okay, so let's go. Let's see if there's anything else in here I want to address, and then we'll move on to the other eye. Again, guys, when you get a report, anything I miss here, you're going to get in the report. So it's not. All right, so right here, you see this kind of thick color around the iris? That's what we call a skin ring. And so this person could have potential skin related problems, or they did, you know, as a kid. Could have skin, you know, rashes or stuff, you know, going on during a detox. But seeing up here, remember we talked about this? That's the thyroid. And it's genetically weak, and there's all this lymph stagnation right here. That puppy trabeculas, heavy lymph stagnation and genetic weakness. The thyroid, what does it do? It helps produce temperature, your basal temperatures, right? It helps your metabolic rate, so it heats up the body. That's what it, you know, the body's supposed to do when we have a fever. It's supposed to heat you up because your skin is your largest eliminative organ. And so if you're not sweating properly, you're not eliminating waste through your skin properly. Or if you're not producing enough heat, then it's really hard for you to sweat out that excess waste, especially seeing down here. Come on, sticky tablet. The kidneys. So if the kidneys, let's assume these kidneys, because they look weak, aren't filtering, and the thyroid's right here, waste isn't coming out through the urination, through the kidney channel, and waste may not be coming out through the skin because of the thyroid connection. And that's why we're seeing the skin ring, that dark color right there, that shade look.
He said dandruff is the only skin issue he's had so far.
Okay. Yeah, well, that's a part of it. I mean, I've never really had a lot of skin related issues just in general. I had acne when I was a kid because I have that skin ring as well. But during detox, I was dry brushing all kinds of stuff out of me. And I used to have, I never sweat. Ask him how he sweats.
Yeah, how do you sweat, Aaron?
There's always been somebody that doesn't sweat well. It takes them a lot of work to get their body sweating. So either way, I'm seeing the skin compromises right here. So we got to get those kidneys filtering, because if you don't, and let's say you go on a detox, I'm almost positive you're going to have some kind of skin related detox symptom. All right, let's go to the left iris.
Okay.
Spending a lot of time on that right eye.
Yep. It's all good. It's all good stuff.
Yeah, I'm noticing that it's doing it the way we're doing it. I could explain a lot. It's kind of like education and an iris reading at the same time. I'm actually kind of teaching you guys how to do iridology right now. Simply. See, I'm probably not the most technical iridologist you're ever going to come to, but I'm trying to simplify it. And if you know how to get to the root of the problem, that's the most important.
He says he sweats a lot compared to others.
Okay, so that could be it too, though. Okay, so over sweating. Let's talk about that. So that's not necessarily the thyroid. Well, it could be. Hyperactive thyroids can cause over sweating and cause under sweating. But anybody that overly sweats, why is that? Well, we saw in the other iris, his right kidney was weak. If the kidneys aren't filtering, then the body will use the skin to make up for the weakness in the kidneys, because the body wants to pull waste out through urination. But if it can't because the kidneys are clogged up, it's going to go to your skin. And so over sweating a lot of the times are an indicator that that person's kidneys are really in bad shape. All right, so again, I want to show that black line. It shows better in this eye. Oh, you don't want to work now, huh? The arrow's not moving with me. Oh, okay. So now that I have, all right, that's a distraction. Put that aside. All right, so right there, you see that dark shade, that black shade?
Yeah.
You can get really good in this eye. This person has a lot of mucoid plaque. Now, maybe ask Aaron just right now while I'm doing all the other reading, if maybe he has a history of constipation, or how's his weight? Is he somebody that's the hard gainer? It really takes a lot to gain weight. Could be somebody with that overeats as well, or just never satiated and satisfied with no matter what he eats. But I'm seeing it. The eyes are definitely showing me right here that this is chronic malabsorption. So,
Yeah.
and we see right here.
He says he doesn't sweat a lot anymore, but he used to sweat a lot.
Okay.
I know this past year, Aaron's been, because I've been kind of on a similar path. He's been on the fruit pretty consistently.
Okay. Does he have discomfort like right below the chest? Like, does he feel like something's sagging? Because like in the transverse colon area, if he feels like discomfort in the transverse colon, it could be because of this. You see this right here? See how it kind of U's?
Yeah.
See that U?
Yeah.
That's prolapsing right in the sphinctic, sphinctic fixture of the transverse colon. It's prolapsed. And there's that big black dot right there. What is that? I mean, I don't know for sure what that is. It could be a drug deposit, an iodine deposit, or it could just be chronic lymph is accumulating in that prolapsed transverse. So I'm seeing it right here dead on that there's some prolapsing going on in this transverse colon.
He says he hasn't had any real major bowel issues.
Okay. That's good. Maybe his adrenals are working good enough to where it's not slowing down the bowel movements. And if he's been on a clean diet, for a while now, then maybe back in his past, quite possibly. You said he's been on fruit for a while, right?
Yeah, since the end of last year is kind of when we both set out on a juice fast, and then he's been probably even more consistent than I have on mostly just oranges.
Okay. Now, we always want to check for kidney filtration. The way to do that, just for your listeners, if they're not familiar, is that you pee in a jar. Are they familiar? Or should I go over it?
No, it's good to go over. I mean, I think a lot of people are, but it's always good to remind.
Yeah, so, I mean, we've been said that if we pee in a jar and our urine is clear, then, you're hydrated or whatever. It's not the case, because those of us fruitarians that are way more hydrated than the average person, we may see kidney filtration. We may see our urine looks dirty and there's cloudy sediment, but we're hydrated, right? Because you need to see material in your urine in order to know if your lymphatic system is removing waste matter out of the body. And so we want to make sure that, that you test your urine on a juice fast, especially because juice could really, it's not the best tool for kidney filtration. But anyways, I don't know why I was going over that, but all right. So the left eye, you see the lacuna right here? See that big circle, that basketball right there?
Yeah.
All right, let's kind of line that up. That's right in the forehead temple. Does he have any histories of headaches?
Yeah, Aaron, any headaches or?
Because it's genetic. There's definitely genetic weakness right in that temple, and it's not promised to give you headaches, but
yeah.
It's just something to know. Whenever we see lacunas like this in this part of the eye right here, this whole top part, right? We know that there's a disadvantage to certain tissues in the head. And your head, you want to keep clean because that controls your central nervous system. All right, so let's go over here and see this one. Seeing some lymph stagnation, and I'm seeing a lacuna right here on this side. That's right where I was saying earlier in the cerebellum. It could be possible that on a detox, getting up too quickly, maybe he's experienced this. I would be shocked if he hasn't at some point on a juice fast, if he hasn't got up too quickly or something and felt dizzy, or, like he balances off, blurry vision, your equilibrium's off. That's because I'm seeing right in the cerebellum. That's the back of the head that controls your dizziness and equilibrium centers of the body.
He said he had headaches in the past.
Yeah, that's probably why. Headaches and migraines, that's showing up in the eye. But right here, another part, that's the back of the head. So another lacuna. So we've looked at 2 lacunas. If I go over all this, we'll just take way too much time. So I'm gonna go down. Because either way, if there's any kind of dysfunction going on in the head area, which again, you're blessed to, I don't see pineal and pituitary really in this eye. So both eyes are showing me strong pituitary and pineal glands. I don't see that a lot, so that's a good thing. But we need to get those bowels moving. This is a lot of thick waste in the transverse colon. And so,
yeah, I had a question in the chat, and I think it'd be good to touch on it because that was something that was very illuminating for me. Hearing you talk about juice fasting and how that's not necessarily the ideal approach especially for kidney filtration, and why that might be. So can you kind of expand on that?
Yeah. So what I've learned, early on my journey was that my kidneys seemed to filter better on mono fruit, and I also wasn't peeing as much when I was on juice. And so a lot of people, they have weakness in their bladder already. So they have sensitive bladder. So anytime, fluid goes in the bladder, the body wants to get rid of it because the bladder might have connective tissue. So it's very sensitive. It doesn't want to hold on to a large amount of water, urine. And so if you're because we're not created as juicitarians. The fiber is there as for a reason. It's there to feed the microbiome, and it's also there to kind of slow down the rate of how liquid enters the body and how sugar's metabolized and all that sort of thing. So if you're overdoing the fluids, especially those that are on a juice fast and drinking water, they're going to be working their bladder, putting a lot of pressure on the kidneys. And so if the body's too busy trying to get rid of all the excess fluid, from whatever reason, the lymph system gets stagnant. It's like the body needs to be in like a dry fasting state in order for the kidneys to really filter effectively. Now, I could filter no matter what on a juice fast, but in the beginning, I really struggled unless I was intermittent dry fasting. I was on a mono fruit diet. And the reason why I think it's more effective is because I healed really quickly. Because I was really making sure that my kidneys were filtering, and I checked every single day. And that's just something that I've observed, not only with myself, but just working with people. I ask them, hey, are you like me? Do you struggle to see filtration when you check your urine on juice? And like, yeah, all the time. I just don't see it ever. And then they get on the mono fruit and they do the intermittent dry fasting that I recommend, on certain hours, evening through the night to the next day. They noticed more kidney filtration and their symptoms were going away quicker. So with that, it helped it click for me to go, well, it makes sense. You're not really giving your kidneys and bladder a whole lot of time. It's just, you're just flushing, you're just putting so much liquid on the kidney so quickly. And that's why when you drink a lot of water, you have to pee excessively. So if you're peeing excessively, you're putting too much tension on the kidney so that the lymph system doesn't quite filter as much. Again, this isn't like a fact, but I think the theory is pretty, it makes a lot of sense.
Yeah, I've just noticed in my experience since I've started incorporating more intermittent dry fasting, my kidneys do filter better. Like it seems to me more consistent, whereas I didn't really see it very often prior to. So I'd say there's a lot to it.
Right. So it's like you need to rest the kidneys in order for them to clean better. Same thing with the bowel connection. conserving digestion so that the bowels, like say somebody that has ulcerative colitis, well, you really don't want to put any fiber if somebody's bleeding out of the colon, because that could really exacerbate damaged tissue. And then if you're exacerbating tissue, it doesn't heal quicker. You know that to be for sure. So I think there's the same connection with the kidneys as well. We need to really relax these tissues as we hydrate and alkalize with our diet, but also give a lot of fasting time so that they'll heal. And I think the kidney filtration is just teaching us that that's exactly what's happening, because if you're pulling more waste out of your body, then tissue will regenerate. You have to remove the acid before the cells can get stronger. So that's why I'm a real big kidney filtration guy. Because, those would be like, I've been on juice, I've been doing everything, what's going on? Well, are you filtering? Not really. That's why. Because those that filter, like for example, I had a client that had extreme steroid withdrawal. And he, just burns from head to toe. His whole body looked like a zombie. Like it was really, really bad. He would laugh if I said that, so I'm not picking on him. But I put him on a fruit diet. I put him on an herbal protocol, and his kidneys happened to be filtering really good. He had strong genetics in his kidney and adrenals too. He had that advantage. And after like 3 weeks, he healed himself. What would, for somebody with steroid withdrawal, let's say on a juice fast, it's not filtering, or him just eating fruit as much as he wants and doing some, the intermittent dry fasting protocol that I recommend with the herbal protocol. Why is he healing over the other person? Well, he's filtering better, and I'm seeing it right before my eyes. And that's what really helps me to make these statements, with some validity attached to them.
Yeah, it makes total sense.
All right, let's look at this right here. That right there is, again, the bronchioles and left lungs, showing that right in this area. Let's go down right here. We'll see those lacunas right there. That's going to be in the thymus gland. The thymus gland is really, responsible to help, with hormones and steroids to help with the lymph system as well. If you strengthen your thymus, the lymph system flows better. And also the spleen. So there's some weakness in the thymus. Right here, you see this big glob? That's a lot of mucus in the body in those tissues, or it could be a swollen lymph node in the left chest. So in the left chest area, could be, there's a lot of mucus there. So yeah, his eyes definitely do tell a story, though, that I would be surprised if he didn't have a lot of like lung related stuff going on, or coughing. Does he have any history of smoking or anything like that?
I know Aaron, I don't think he smoked tobacco, but certainly he smoked cannabis.
Yeah, well, any smoking is bad for us. It's marijuana, smoking is combustion. Any kind of combustion will irritate the mucosa and create a lot of mucus, because combustion of anything is acidic. So that's probably why I'm seeing this, is because of his past of smoking marijuana. But hey, I'm not judging nobody. I used to as well. I was a big pothead growing up before I woke up to health and all that. All right, so the left iris, you see this big giant lacuna, big diamond right here? That's right in the abdominal wall. So I'm seeing genetic weakness in the abdominal wall area. And again, the groin, the hip, the femur is showing. I think all this is showing up as well because of that parathyroid weakness. It would be interesting to know his family history, because he's like, I don't have any of these problems. Maybe his mom or his brother or his sister or somebody in the family does have these related issues. And that's why I'm seeing lacunas, because they've been passed on to him. And so if he wasn't careful and he hasn't made any of these changes, then he might have run into these serious problems where he could actually feel it, But this strong genetics, strong constitution, a lot of the times holds us up, so where we don't know that we have any of these problems, and then all of a sudden one day, boom, explosion, like what happened to me. And then all these things reveal themselves. But good on Aaron for changing before that happens.
Right. So essentially, if he had continued down a path of eating, animal products and junk food and all sorts of other things, like he would have gotten to the point where he'd experience it maybe all at once, kind of thing.
Yeah, or just in stages on his detox.
Yeah. Gotcha.
Sometimes you don't feel the detox either until the kidneys filter. It's like, because the waste is still dormant in the body. It's not really coming out. Once it makes its way out, that's when it's like everything trips up and you start feeling these healing crises. So right here again, quite possibly left knee weakness. I'm seeing lymph stagnation all right here in his left kidney. So yeah, I don't know if juice feasting's I mean, we got to do the juice fasting to clean the bowel wall up. I get that, but we don't want to live there for too long. We just want to adopt a monofruit diet. And if you adopt a monofruit diet, you're going to clean your bowels too, and you're going to clean your lymph system as well. So it's the best way to do it, in my opinion. And, you know, tell him to do the kidney filtration test. And if his urine is really clear, then this is because of what we're discussing here today. His kidneys need a lot of work. They need to drain properly.
Yeah, he's saying his kidneys are filtering.
He's doing everything right. So none of this makes. All right.
Yeah,
Well,
that's essentially what he just sent me a message. I don't relate much to what he's saying, but he's wondering if the picture quality can affect the reading, or but he said he'd love to talk with you more.
some people don't resonate with the reading. Some people, you know, they just don't for whatever reason. And then others are like, oh, everything you're saying. I don't know. But, you know, his genetics are good. So maybe because he's doing everything right, he's on the detox, he's on the fruit, that because of his strong genetics, even though there's these weaknesses showing up in the kidneys, he's doing everything he's required to do. That's why we're not doomed with these problems. If we're using the right tools, and you happen to have a good genetics and good constitution, then it shouldn't take you long to get your kidneys filtering. So that's good that he's filtering.
Right. Yeah. And
That's
I know his diet has been real alkaline this year, so that's definitely going to help with that too.
Now this right here, this lacuna area, you see this circle right here, and then all down here.
Mm-hmm.
You know, this is the prostate and the bladder. Does he have any history of you know, urinary problems, overactive bladder, peeing the bed? I don't think he would, because his pituitary is so strong, but definitely seeing prostate. The eyes are telling me. That's all I'm seeing right here. Doing an iris reading is that his prostate is definitely showing me genetic weakness as well. Maybe someone in the family, dad, anybody have prostate issues, you know, like, you know, swollen prostate or prostatitis, trouble urinating, or excessive urination. Could be, both of those could be a byproduct of weak prostates. Seeing lower spine as well, all right here, mid back. Now let's ask Aaron what his symptoms are.
Yeah.
What are his symptoms? Because I'm sure he went to the fruit diet because he had problems, correct?
Yeah, Aaron, do you have, he said no peeing problems. Do you have any health related issues to note? You know, anything that sort of prompted you into this, or stuff that you're feeling still? Anything to talk about that we might can correlate?
Yeah. So right now though, I think we should finish up and go to somebody else's, do another one.
Yeah.
We have time.
Yeah, I'll pull up another one. So we'll switch to Nicole next.
All right, let's go to Nicole.
I'm gonna pull up her left first. Or do you want to, does it matter to you? I guess we'll start with the right. We'll start with the right. We did the right first last time.
Just waiting for, all right, this person has really good genetics and constitution.
It's going to give you remote control.
Get that zoomed in. I'm seeing drug deposits in this one, sulfur deposits, antibiotic, history with antibiotics. This person could have parasites too. So yeah, so we see this eye, we see that it has a real nice, you see these fibers, you see how straight they are?
Mm-hmm.
It's like a spoke on a wheel, like on a bike. You see, you know, the spokes, they're real nice and straight. These trabeculas are nice and straight, meaning that this person has an excellent excellent constitution and excellent genetics, which means that even though I might call out problems, if she's using the right tools, she could really do a lot of good with cleaning out her body. Now, you see
Yeah,
that,
she said she had to take medication for rosacea.
exactly, and that's what these are right here. We call these psoras. These are these little patches. Rosacea is a skin-related problem, right? So these psoras come in the body because of parasitic stuff in the skin, fungal problems. That's sulfate-looking color too, though. So it could be from the sulfate derivatives from the drugs that she has stagnant in her body. So it's these drugs that they subscribe for these problems to suppress these symptoms actually end up causing more skin problems down the road.
Can't imagine that.
So, this person will really benefit from like green juices to help pull the heavy metals and the chemicals out. Fruits are going to do the same thing, but green juices are really effective for that.
Cilantro is great for that.
Yeah, cilantro, stuff like that. So right here, you see the bow wall again. That's the small bow, right? Right down here, it's all puffy and clogged up looking. You see right here, we see that gray color right here, right on this eye. That's malabsorption. This person might be underweight, or she will be underweight. Well, not underweight, but she'll lose more weight than she might desire if she's on a strict detox. But it's only for a season, of course. The body rebuilds itself if you clean it properly. But we got to get that small bowel cleaned up so that she can get better nutrient absorption. This is a sign of poor nutrient absorption. Right here, we have this big lacuna waving out here right there. This is a right iris, correct?
Yes.
Right. So this is lymph stagnation, all in the parathyroid area, swooping down all the way. And it's all spastic as well. In the bronchius, the thyroid, the throat area. You see a lot of chemicals right in this area of the eye. See this offset color? Ooh, come on. Go back.
Here, I'll get you back in.
All right. Tablets are not the best for this. At least mine's not. All right. So right here, this color right here. Why isn't the arrow coming with me?
It's moving for me.
All right. So right in here, there's that offset yellow color. That also could be the chemicals from the pharmaceutical drugs. And that's like in the sinuses. It's also right in the pituitary and pineal glands. So it's collecting a lot of those chemicals in those tissues.
Yeah, she says when I get sick, it hits my throat.
Yeah, that's this right here. That's all this right here. All this lymph stagnation. That big puffy worm right there is lymph stagnation, all in the esophagus and throat area. So she's got to pull that mucus out. Robert Morse has a 3-lung herbal formula that's really effective for that. But of course, you got to stop putting mucus in as well in order to pull out the old mucus, right? We're seeing.
She gets sinus pressure.
Yeah,
like you're saying.
that's all from that. That's all from this right here. That all this color is all heavy lymph in the sinuses and in the head. All right, let's look at this lacuna over here and see where this is at. I'm going to do my best to line it up here. That's in the upper jaw. So upper jaw weakness, maybe a right eye weakness. Maybe that right eye is irritating sometimes, gets red. In the forehead as well, is showing weakness. Down below, this is the mouth. Nose, sinus, yeah, so the nose, this is the nose area. Upper jaw. So, they don't have herbs for your mouth, but, it's just getting that head draining and going after the lymphatic system, and all these tissues will regenerate. She could have sensitive gums, though, and teeth. Like a lot of the people, they're told, oh, you have, gingivitis or whatever. It's really just acids.
She said that's where the rosacea hits me, is the right eye and the right forehead.
Okay. Yeah, that's exactly where it's showing up. See, she's responding well to this reading. Some people do, some people don't. It's interesting.
Yeah.
I don't know why, but all right. So what else could I point out as I go along here? I'm just kind of mapping the eye. I've seen some little bit like right here, see these, lines and lacunas in the spine area, showing a little bit of acute weakness. But right here, this big drug deposit or this sora, could be right in the, it's right in the lower back bladder area. So, let's say this person's on a detox and their kidneys start filtering and they experience burning. Oh, wow, what's going on? This detox it's giving me a UTI. A lot of people that happen. This might happen to her where she might feel a little bit of burning. So I would prepare for that with two kidney formulas to help buffer that possible reaction that might take place. But I don't know for sure if this will happen, but if I'm seeing it in the bladder and, uterus, vagina, that type of area, then that could happen. That could, don't be alarmed. It's just, it's pulling those chemicals out so that so that those tissues can get stronger.
Yeah, and based on what you said earlier, she says she does have gum recession, but the fruit's helping. She's been on mostly all fruit and veggies since December last year.
Yeah. So again, when I go up here, right here, I don't think I noticed that before, but that's that dark color right below that squiggly line. That's her parathyroid too. So if she has parathyroid weakness and thyroid. And like I was saying earlier, parathyroid controls calcium utilization. Well, gums is where there's a lot of calcium, a lot of connective tissue. So the body likes to steal from the gums to neutralize. So as she hydrates and alkalizes with the fruit, and she gets this head drain, those receding gums will improve, like she's experiencing.
She said so far none of the urination burning. So fingers crossed. But like you said, you might experience it. So just something to note.
It's possible. Right here too, in the ovary. How is her periods? Her right ovary is showing the same chemical deposit. So during her period, she might feel her ovaries a little uncomfortable.
Yeah, anything there, Nicole?
Let me go down here though. I want to show again. We're showing not so much the adrenal gland. There is some mucus congestion there, but this is the kidney. This is the right kidney showing a lacuna, but it's only acute. But there's a lot of lymph stagnation as well. So she has a weak right kidney, genetic.
She says she's postmenopause, so no periods, but it was never a problem.
Okay, that's good. I'm seeing some abdominal wall weakness as well. Again, though, her genetics are really, really good. So she could do a lot of good work for herself just from the detox. Anything going on in the right breast? Sometimes, breast implants will show things in the eyes, But I'm seeing right breast weakness right in here. This lacuna right here is right in her right lower breast. So if I'm seeing this, you want to get on the detox because you don't want lumps showing up, right?
Nothing. No, she says she's all good.
Okay. Right here, bronchials. Do you have any history of bronchitis growing up? There's a genetic weakness in the bronchials. All right, so this light right here is creating a lot of reflection, so it's hard to see in this whole area. It's better to get this light in the pupil right here, I'm seeing, there could be some weakness in her right shoulder as well, right neck area. I'm seeing medulla right here. Here's the medulla oblongata.
She said in her family she's had bronchitis, but not her.
Okay, well then that at least we at least know that what I'm looking at is definitely genetics. So she got the genetic weakness of it, but it doesn't mean she's, because she could be making better decisions that her family makes and avoid those problems. I'm sure she's on this channel as well. She's probably have made changes to her lifestyle with what she eats, correct?
Yeah, most people have. They hear it enough from us. So
how's her memory going? Yeah, exactly. I'm seeing some weakness, subacute in the inherent mental part of the brain. Right here, I'm seeing, this is right in.
Yes, shoulders for sure. swimming injuries.
Yeah, that's showing up just like the last one. So we called that in both of them. The shoulder injuries show in the eyes really nicely. Transverse colon right here is looking obstructed. So there's weakness going on in the transverse colon, which makes sense. The head doesn't drain. Just zoomed out on there.
I got you.
Zoom back into that if you want. But overall, I would say that, she's probably got fungus and parasites in the body. That's what we need to address with parasite herbs. Stay away from like fermented foods like dairy and fermented drinks and fermented foods and breads and yeasty foods and all that sort of thing. I would be surprised if she's on a proper detox that she doesn't see parasites come out. I mean, I'm not trying to be graphic, but I'm just giving you guys a view here. This is very common when I see the psoras or sulfur deposits that the person could have some fungus, candida type stuff.
As she says, yikes. Well, the memory is what it is at 55, and I used to love yogurt. So I used to eat that a lot.
Yeah, love yogurt. What's yogurt? Yogurt's a fermented dairy. That's what the fungus and parasites love. So that kind of ties into what I'm saying.
Yeah, and she's still, when I fall, it is for bread, so still some yeast too. Yeah,
she's got that look with those sores. I don't know if this is a skin ring like we were going over in Aaron's eyes. That could be just the reflection from the lighting. The lighting's not the best. Of course, these looks are going to be subjective if the photos aren't the best, but this is not a bad photo. It's definitely. Let's go to the other eye.
Okay.
This photo is pretty good. I need to buy a couch. I'm getting uncomfortable here. I'm not going to buy a couch. I'm a minimalist. All right. So let's look at the left eye, right?
Yep.
All right. First thing I want to say is, is she familiar with any left leg weakness? Because it's dead on in this photo. Right here. Let me show. I would be surprised if she doesn't, because that right there is right on the left leg. Do you have any injuries on the left leg or just any left leg related problems? Right next to that left leg though looks to be a swollen lymph node right on the sigmoid. See that dot right there, right on the bow wall? Again, guys, this is the bow wall right here.
She said not really on the left leg, but she did sprain her ankle.
No, it's not really in the ankle area, but yeah, so right here, this big gash, this big crypt or lacuna, see how black that is?
Yeah.
It's really interesting. It's right on the left leg. If it's not left leg, it's just showing genetic weakness in the sigmoid area, because right next to it is a lymph node. That ball right there, that dot, that's a swollen lymph node in the sigmoid. Right here, see how the bowel wall is extending out like that? That's ballooning. So there's heavy congestion in the descending colon. A lot of descending, it's ballooning out because it's holding on to a lot of waste matter, and that needs to be detoxed out. Right up here, I'm seeing a black dot. Iridologist, we never want to see black dots anywhere, but it's sitting right on the transverse as well. It could be an iodine deposit or a chemical deposit of some kind. I'm seeing right here little bowel pockets as well for her and the transverse colon area. Malabsorption ring showing too in this eye. Right here, we see another crypt. That right there is her left rib area, solar plexus. Right here, your autonomic nervous system is right below that solar plexus. The shortness of breath, that sort of thing could happen with solar plexus. weakness, or it could be left arm, kind of right in that area. It's just really hard to tell, winging it like this. Right here, we're going to go down towards the pelvis and also her left ovary. Does she have any history of like miscarriages in her past?
She said, I don't remember exactly what you just said, but she said, yes, I get a cracking when I do my yoga.
In her right, her left arm?
Yeah, whatever you were just talking about.
Yeah, that's what.
And then no to the miscarriages.
Okay. Well, her eyes are definitely showing weakness in both. I saw both her ovaries. But, you know, for healthy women, I'm not trying to pick on anybody.
Oh, no, she said on the rib, not on the wrist. She gets cracking when she does yoga on the right.
Oh, on the ribs. Okay, so let's go to this. And you guys could test this out for yourself. So I'm not just saying, oh, you should, let me make it look good for you. Oops, let me go back to, God, I hate when it does that, man. It just zooms fully out on me like that. So that's something you got to figure out.
Yeah, I don't know if you have a laptop, it'd be easier to do with a computer.
Yeah, I just never needed one because I like just having like easy things to work with to do what I have to do and travel and all that. But I think I'm going to get a laptop now. So right here, do you guys see that? See that? That's dead on her left ribs. It's showing that circle or that oval. That oval look is genetic weakness in her left ribs. So her body's just stealing calcium from those ribs. Don't know exactly why certain areas get compromised and others don't, but all right, so let's go down right here. This looks like some groin weakness going on. This person though has an eyes where it's like, I don't think they're gonna have a lot of health related issues. Again, this person also doesn't have, I'm not seeing pituitary and pineal glands, so that's really good sign. Usually those that have pituitary issues, they feel everything in the body. This right here looks like some connective tissue weakness in the small bowel. So is she underweight at all?
No, she said she was overweight, but she's lost a lot of weight since shifting her diet to mostly fruits and veggies.
So it could go both ways. It can go, malabsorption could be overweight people have malabsorption or underweight people. Depending on the thyroid function, you know, slow metabolizers, you know, if I see malabsorption with somebody that has thyroid weakness and let's say they have a hypothyroid problem, then they usually are overweight. Those that have parathyroid or malabsorption with hyperactive thyroids, usually like somebody like me, get really, really skinny. So it can go both ways with malabsorption, but it looks like there's some connective tissue weakness showing up in the small bowel area, possibly prolapsing going on. Right here, again in the throat, there's a psora area. So other than that, kind of zoom out a little bit, look at the eye. And let's move on. I think we did that one. So first, let me say here, not always, you know, sometimes with detox or early in the morning, but you see all these veins in the sclera area. All these veins right here indicate
you zoomed out.
Inflammation in the body. But her lymphatic system's only acute because she has, you know, a nice blue eye. And so in iridology, they, you know, has been taught by Bernard Jensen and Robert Morse, is that there's two eye colors, right? Brown and blue. But that doesn't mean there's not different shades of brown and different shades of blue. It's just, it's the look of the eye should glisten and be clear like a marble. And so right here, just real quick, I just want to say.
She said it was first thing in the morning, so that could explain the veins.
Okay. Yeah, it could just be detox. The eyes are just draining. Lots of heavy lymph though, right here in the head area. So this type of person, you know, on a good solid detox might really get a lot of drainage going on, mucus coming out and that sort of thing. So be prepared for that. And maybe this reading will make even more sense once you start really getting deep into the body and detoxing. A lot of the times, you know, that's another thing too, is I've noticed that people that come to me that's done like 2 to 3 months on a detox, they seem to resonate more because they didn't really have those types of symptoms prior. Sometimes symptoms reveal themselves when you get rid of all the stimulants and the, you know, the lifestyle that hides those problems, you know, because when you go on fruits and vegetables, they expose everything.
Right. Certainly.
All right, let's move on to the next one.
You want to do another one? We're at 90 minutes, but I'm down to keep
Yeah,
going.
let's do one more. We'll just do one more.
All right, so we'll do, I think Diane was in the chat. So Diane, I don't know if you're still with us, but we'll do yours next.
Well, I see how we're doing this. We're doing this kind of like how you saw me do it on Instagram.
Yeah, exactly. Just people who are here to have input, it's helpful to do that. So we'll start with Diane's right eye. The second picture for her right eye, I think you said was better. Just let me know if this is not the one that you want to do. And
I would love to read Mindy's eyes, but she's not here, so we'll wait.
I think she said Mindy Ferguson.
Oh, I want to read these ones too. Yeah, I definitely want to point out some things here. Okay. Just so that, because this is a perfect example for me to help people understand what I mean by 2 true eye colors.
Mm-hmm. Let me give you control.
All right, so let me go to my email. Okay, that's somebody else's. That's Aaron. Okay, I don't know why I'm not finding that eye.
Diane, she sent 4 pictures, 2 of each eye, and she had the description with her health background.
Totally. We went over it, I remember, before the live. Let me see if it went to trash for some reason.
I think the email name was like .cello or something like that.
Yeah, I remember going over it with you. Before the.
Yeah, Mindy, thanks for being here. I think we'll probably, well, it's really up to, it's John's call, but I think we'll probably end after these eyes. But you can be first up next show. But I don't know, maybe John will want to keep going. We'll see how long we can get him for. And yeah, just while John's looking for that, for all of y'all who are getting your eyes looked at today, and anyone who's gaining some information from this, you know, you're finding the value in what's being presented here. Make sure to share some love with John if you're able to. I've got his PayPal linked in the show notes. It's always very appreciated and this is what we talk about a lot of times, where we're shifting out of this debtor mindset, where we're not charging people for things all the time and we act as a creditor. John is acting as a creditor and sharing abundantly in the information and the knowledge that he's gained, with the understanding that we operate as a creditor and reciprocate based on that energetic exchange. And this is how we shift into this new world, away from this sort of debt-based mentality and get into that mindset. So yeah, and if you want to get a full iridology report done, like John's fantastic. So I highly recommend that as well. So if you like what you see, definitely reach out to him.
Thank you. Yeah, absolutely. 100% one mind with what you just said.
Yeah.
You know, education, I feel like, should be free. And then, you know, if you want to work with me on a personal level, then you can support me as I help you as well. So as we look at these eyes, you know, everybody, and even what's her name again? I'm sorry.
This is Diane.
Diane. Oh, that's right. We're going to look at her health history too, a little bit.
Yeah.
So looking at her eye, Diane, she probably thinks my eyes are brown. Well, there's a nerve ring. So you see these nerve rings. You could talk about that as well. But first I want to say that when these nerve rings show up in the eye, a lot of the times I could tell whether it's a true brown or a true blue. Now, what do we see in this nerve ring? That's not brown. Looks green, bluish to me, right?
Mm-hmm.
So this person, and I've seen it happen, and I've seen it in school over there in Florida with Robert Morse. He threw up photos of before and after. He's blessed to have a lot because he's been doing it for so many years. And he showed eyes like this on the screen, where he's like, see the blue? This is a before look. And then he showed an after photo, and half the eye on the bottom was completely blue.
Wow.
It changed to blue because she really was disciplined and went after the detox for many years. And she was lucky to filter her lymphatic system effectively. And she noticed that blue was starting to show all throughout the eye. So
does that typically happen that way, where the lower half of the eye starts to shift first, or is it vary from person to person?
I've seen it with me, and I've seen it with Robert Morse through his clients that he showed on the screen. It's not a typical thing for everyone, but it seems it does happen. I don't know why. I'm sure I could figure it out, but I'd have to go and kind of observe and tie it together and make a possible case for it. But so knowing this, even though she's got, this photo is not the best. So everybody needs to understand this is not the best photo to read, but I'm going to do my best to read it. And I wanted to read it because I wanted to talk about the subject, but it's not the best photo. It's kind of blurry and that sort of thing.
Yeah, just to note on that, when you are taking your eye pictures, just make sure on your phone that you have your settings turned up to where it's going to be the high definition photo. And then whenever you transfer it to email or send it over, a lot of times phones and software will automatically compress the image. And you don't want to do that. You want to make sure you're sending the full size image of what's been taken with your phone. And this is going to allow us to be able to zoom in clearly, along with making sure the picture is not blurry when you take it as well. So these are just some things to be helpful to make sure that, when we do take a look at these, Jon has the best look at them and can give you the best perspective.
Facts. Yeah, absolutely. So this eye, still very fine patterns. I'm going to assume, it's good enough, even though the eye's blurry, to know that this person has good, solid genetics and constitution. And it makes sense too, if she has chronic lymphatic problems like this, with this brown color, with this blue showing up. So in iridology, the way that Robert Morse has trained me, this means this person has chronic lymph problems. So overall, from head to toe, I'm going to say chronic, very chronic lymphatic problems. So the lymphatic system from head to toe, like these are like the fibromyalgias of the world, those that have pain in the body, quite possibly, just strong chronic constipation maybe, or just inflammatory conditions. They put labels on things like itises. Anything with an itis on there indicates acid stagnation, inflammation in certain areas of the body. So, lots of, sensitivities to foods, allergies, just all kinds of problems.
Yeah, she said massive lymph issues, lumps everywhere, and yes to constipation.
Yeah, good. Glad that she was talking in the chat. So lumps, what are lumps? What are swollen lymph nodes? What are cysts? What are pimples? What are boils? What are abscess? What are tumors? These are all houses in the body of stagnant lymph that's not being drained. So exactly a perfect example of somebody with lymph problems that has lumps on their body. So she really needs to open up those kidneys and get them filtering. And if she does, and she hydrates, she'll see her eyes looking blue, and she'll go, wow, I have blue eyes. This is crazy. So she's definitely going to be somebody that needs to get her kidneys filtering, and then she would really benefit from the lymphatic herbs. And Robert Morse has a large line, I don't know, large, but I don't know, like maybe 6 or 7 lymphatic formulas you can play with. You don't want to take lymphatic formulas though if your kidneys are not working, because if you're moving your lymph really aggressively with the fruit and then you go on the lymphatic herbs and you're not filtering, you could stir up a lot really quickly, and that could really create a lot of healing crisis, and that can be scary. So you want to avoid that. So for her, she's definitely going to benefit from that. Now, what's surprising though to me though, is somebody that has this eye look of a chronic lymphatic system, is I'm not seeing genetic, right here, maybe. It's hard with the, this quality of this photo, but there, yeah, I'm gonna say right kidney weakness right here.
Yeah, she said her kidneys are not filtering.
Yeah, she's got to get them filtering. So she's definitely aware, it sounds like, of the detox. So this right here, these dark lines, see those? All right here and way up here in the head area, we call those radius solaris. This means this person has a lot of bowel related issues. I would say interstitial, not just what's congested to the bowel wall, but inside the bowel is extremely acidic. So the body is just cells, spaces, and two fluids, and blood and lymph. And so if that lymph system's backing up inside the bowel wall, then these radius solaris pop up. Also, it means the head's not draining, because the radius solaris indicate possible brain lesions. Bernard Jensen said that slow moving bowel as well, especially in the transverse. He also made a case too, I'm not sure if it's fact or not, but those that have radius solaris could also have parasite infestation in the body as well. So pay attention to that.
She says she has large bags under her eyes, based on something you said earlier.
Yeah, her kidneys aren't filtering, man. Bags under the eyes mean her kidneys are not filtering. This is why I'm seeing weakness right here in that left or in that right kidney. So all this radius solaris though, that means that the pituitary, chronic.
Tons of parasites, she says.
Oh, so there it is. So pineal gland is down. Anybody in the family that has MS or any kind of central nervous system weakness, Lou Gehrig's, dementia, Alzheimer's. Let me go back to the nerve rings though. So these nerve rings though, you want to, it's hard to tell whether she has them because of the photo, and those that have chronic lymphatic problems also, it's hard to know how the state of the nerve ring, because the eyes need to get clear for those nerve rings to really reveal how bad they are. But I'm only seeing, go ahead.
She says not that she knows of the neurodegenerative illnesses, but mostly cancer in the family. Yeah,
so cancer is lymphatic, all lymphatic. Cancer is nothing but a damaged cell, that's all it is. So damaged cells only happen when the lymph system doesn't drain. Because if the acids don't come out, the tissue gets compromised. It's a little too zoomed in now. Okay, so let's go back to quite possible right leg weakness, groin, hip, groin, femur, hip looks weak, possible right leg. I'm seeing right in this area. Come on, Arrow. Come follow me here. Right here. That's right in her. Yeah, that's right in the right breast or lungs. So I'm going to say it could be the lower left, or the lower right lung, or it could be the right breast as well. So that's showing me something's going on, some kind of obstruction in the right breast or lower right lung area. Liver and gallbladder's down, all right here. The radius solaris extending down though, but the liver gallbladder's down. Right here, uterus, chronic uterus weakness.
She said yes, lumps in the breast, right and left.
Okay, so that's the lump right there. This right lump, that's what that is. So this is, so for the viewers that may have been skeptical earlier because people aren't resonating, this is going to help you understand what I'm seeing. That's what that is in the eye. That's the lump right there in her right breast. And you can check the chart too. So go to the charts online and you can look at that and see what I mean. Bladder, uterus weakness. Those that have uterus, might have like, endometriosis or interstitial cystitis. And inflammation of the uterus and bladder, uterine fibroids, cysts, that sort of thing. I'm seeing right here too a skin ring. So she could have skin related problems, poor circulation of waste coming out through the skin. It's hard to know whether she has thyroid in this photo because of that light right there. Other than that, I think we briefed that one. Let's go to the next one.
Okay.
Oh, I'm seeing a violet hue, but those are showing up in both eyes. So she might have elevated cholesterol. She could have, like her arms or legs or something like that might fall asleep, numbness, tingling sensations, just poor blood circulation. The endothelial wall of the venous system gets clogged up with cholesterol to protect it.
So she's got 2 pictures for the left. Let me know if you'd rather do the other one. This is the second one of the left. She says no uterus issues, always had eczema, super low cholesterol, and yes, the tingly sensation.
That tingly sensation is the blood because of that. Let me zoom in on this. See this? You see that violet hue right here?
Mm-hmm.
So that color right there, the violet hue, indicates blood circulation problems. So tingling and all that in your arms or legs or anywhere is most likely because of that. So we got to get some oxygen in your blood, clean out your blood. Again, that alkaline side of chemistry is going to encourage all of that and how you eliminate. Seeing that green look again right here.
She says she's always cold.
Okay, so that's the thyroid. We'll look at that. All this brownish orange color, this is chronic lymph in the stomach and bowel area and lymph system. She could have, if she has any history of antibiotics, that all could be sulfur as well.
Mm.
So, or anything that has sulfate derivatives, pharmaceuticals, supplements, hygiene products, processed foods, wine. I'm seeing thyroid right here. So this dot right here is showing that. Because of the quality of the photo, it's hard for me to distinguish what stage of weakness it is, but at least we know it's there. So saying that she's cold all the time, that's her thyroid, right? So if you check put a thermometer under your armpits, you want to see 98 and above. If you're below 98.7-ish, then you got low metabolic, low basal temperatures, meaning that your thyroid's not producing the hormones to heat the body up so that you have enough warmth. If somebody could be so acidic and it feels so cold because of that thyroid. If you didn't have that, thyroid cooling you, you'd feel everything.
Yeah, she said she's taken tons of antibiotics and used to eat like crap and drink
wine.
Yeah.
Yeah. So all of that,
usually 96.8 temperature.
What is it? 96?
96.8. Yeah.
Yeah. Low thyroid function. She needs to bump up her thyroid. As long as it's not hyperactive, then she'll benefit for sure from thyroid herbs. Now, a lot of the times when people have thyroid problems, though, the first thing I want to look for is pituitary. Because if somebody has chronic pituitary, which I see right here, I could build a case right here, the pineal gland, poor sleeping, not producing melatonin from the pineal gland. That's more the pineal, though. It could be pituitary, though, but I didn't see in the other eye, or else I would have mentioned it, the pituitary connection to the thyroid. Because again, like I was saying, the pituitary controls the thyroid, the parathyroids, the adrenals, the thymus, the spleen, all the endocrine glands in the body. So my point is, if I see pituitary, you're going to get more benefit from enhancing function to your pituitary gland over focusing on the thyroid itself. So I would still, in her case, get the pituitary herbs. Big, thick black. You see all this big, thick black? This is all in the stomach and small bowel area, throat area as well. Same here, this big, black, thick. This is all in the small bowel. she really needs to clear out her small bowel, or she's not going to get any absorption of nutrition. She's got that big black line look, the mucoid plaque in her. How's she experiencing the mucoid plaque on a detox? If not, she's going to see a lot come out of her. I can almost guarantee it.
Let's see what she says.
But doesn't have a lot of serious endocrine gland weakness. Her main issue is lymphatic. So that's good. She just needs to move her lymph system and get those kidneys filtering. Let's look at her kidneys. It's hard to tell with this photo, but maybe there's some lymph stagnation. It kind of gives it that look.
She said, yes, I think the mucoid plaque is coming out and hasn't stopped.
It hasn't stopped, yeah. She's keep going until it comes out, until it slows down tremendously. Other than that, let me kind of look from my phone view now. It's just hard to tell with this photos. The picture's not the best. Yeah, I think that's it for that.
Okay.
Don't want to say any more because it's not good enough photo.
Cool. Well, your call. Did you want to keep going, or you want to end it there?
Do we have one more person that is in the chat that sent the email?
Well, did you send your iPhotos? I don't know. Oh yeah, I got them from Mindy, so we can do hers.
All right, let's do Mindy's and then we'll call it a day.
All right. Just get those.
Always got to go the extra mile.
Yeah, appreciate it. I know everyone else does too.
All right, so throw Mindy's up there on the screen. Oh, she's got major blood circulation problems, small pupils. I don't know, that could be from drugs or central nervous system.
Mindy, are you still with us?
She with us?
I told her we might not have time today, so I don't know if she hopped off. Oh, she's still here. Great.
Perfect.
So yeah, here's Mindy's right eye.
Yeah. See all that? Right where that arrow is, you can see the, here, I'll move it even better to give a better view. Right here, you see that gray or that off shade around the pupil? Malabsorption. Chronic malabsorption needs to clean out the small bowel. Small bowel needs a lot of cleaning. Now, what color eye is this? Is it a brown eye?
No.
Or is it a blue eye?
Those same nerve rings, yeah. It's blue.
This is a blue eye. Because we see all this green, bluish color. Hazel eyes is most of the time, well, all of the time, hazel eyes it's an illusion. Because of all this orange and brown color, it's giving that illusion that this eye is hazel, but it's really just chronic lymphatic problems. She has chronic lymphatic problems. You got to get those eyes looking more blue. Now, remember the nerve rings I was talking about? Look at all the nerve rings. 1, 2, 3, 4, 5. Chronic nerve rings. So Mindy quite possibly might have gone through a lot of trauma in her life, a lot of stress. The nerve rings, indicate stress in the body, low adrenal function, your autonomic nervous system. You're not getting neurotransmitters. You're anxious. You're fearful. You have phobias. Shy maybe. Just overstimulated all the time. Maybe you're just really hyperactive. Or it could be the opposite. You're just tired and you can't lift up your head. But those chronic nerve rings means that nervous system needs a lot of work. Chronic, her genetics are excellent though. So she's got excellent genetics and constitution. But all those thick radius solaris, see those big dark lines? Mm-hmm. Chronic bowel and head problems. She as well, parasites. All right, let's brief this side. So chronic, very chronic. right adrenal gland. And it makes sense because those nerve rings aren't going to pop up like that unless there's chronic adrenal. So she needs to get her adrenals bumped up, avoid stress, irritants of any kind, stimulants of any kind. She's probably not going to do well with stimulants, whether she likes them or not.
She said lots of trauma and stress, anxiety her whole life.
Yep. Well, the eyes are telling me that story. Chronic anxiety. She needs to make serious changes with her environment and everything to get herself in a nice, peaceful place, start loving herself, making drastic changes, because her nervous system at this level, it could turn into MS. It could turn into a lot of serious problems down the road. We don't want that for Mindy.
Yeah, Mindy.
So chronic right adrenal gland as well. It's showing all the way down. By possibly poor kidney filtration. She needs to really get her adrenals working good though for that kidney filtration, because the adrenals sit on top of the kidneys and they control the kidneys. So with all those nerve rings, she probably has either high or low blood pressure. And if it's really low blood pressure, then she's not producing those neurotransmitting hormones to help activate peristalsis, nerve contraction, muscle contraction. So the bowels and the kidneys rely on those neurotransmitters in order to empty the body. Your digestive waste matter through the colon, and then your cellular waste matter through the kidneys. So I would be living on adrenal herbs, and I would be a total hippie, get in nature, relax, and just start loving yourself, and do the emotional and spiritual healing.
She said she had severe adrenal fatigue about a year ago.
Yeah. So her eyes are definitely telling me that. Ascending colon, lots of thick chronic lymph in the stomach. This is the stomach area. So chronic lymph shown right here. Bowel pocketing in the ascending, all right down here. See those little dots, right? Those are bowel pockets. Could have her pituitary again. Pituitary, pineal gland are down, that medulla, everywhere. Inherent mental. Does she have trouble sleeping? We need to bump up that pineal gland with like calming herbs, passion flower, chamomile, valerian, kava kava, lemon balm, malungu, just anything that's really going to calm the body while you work on bumping up those adrenals and working on your relationships, your environment. You're not going to be good for in stressful situations. You need to get your mind calm, get into a nice quiet place. Weakness in the lower jaw and the mouth and the nose. The pineal or parathyroid, so she might have calcium utilization problems, scoliosis. I'm not seeing a lot of spine stuff, depression. Anybody that has chronic parathyroid probably has a history of depression. Again, though, with this eye, there's a lot of shade right here, so I don't get to see anything.
She says she sleeps too much, at least 9 hours a night.
Well, what is she taking? What's her diet like? Because if her diet ain't good, she starts getting on fruit and stuff, she might starts detoxing. She might, have a little struggle with sleeping for a while, or I'm sorry, she might have energy. But that could be to the diet. If your diet's not right, you could oversleep. Depression also causes oversleeping as well. So, I could build a case, on a spiritual sense, that somebody that has nerve rings like this may just not be happy. They don't like the way their life's going. Lots of traumas because of all the traumas in their life. Heavy sulfur, antibiotics, quite possibly, all that orange color. I'm just struggling with this thing. Sorry, brother.
Yeah, no, it's all good. I mean, you don't even have to get a laptop. You could just get a Bluetooth mouse and hook it up to your iPad, and and make it a lot easier.
Yeah, that's the first stage. I'll get more advanced as we go along. Liver weakness. Got to clean up that liver. Liver showing weakness. Not so much in the gallbladder, at least from this photo. Upper abdomen. Again, right here, some weakness in the pancreas, maybe have bloating, gas, digestive problems. Definitely fungal. This person probably most likely has heavy candida, heavy cravings for starches and fermented foods, parasites, ovary weakness. All right, this definitely maybe a case for bronchitis growing up or now.
History of depression, based on what you were saying earlier.
Bronchials right here. Chronic weakness. And again, I don't have any history of Mindy. I don't know anything about Mindy at all. So iridology is pretty cool, where it could help me understand, not just the physical aspects, but also the state of the person's, emotional life too, traumas and stuff. But that big black stuff right there, that big black lacuna, is chronic weakness in the bronchials.
She said she's on a vegan diet, orange juice every morning, but still working on the diet. Digestive issues for sure.
Yeah. Well, she's got chronic lymphatic, chronic nervous system weakness. She needs to get on the detox very, very, very soon here, and start cleaning up that small bowel to really avoid a lot of the weight-related issues, quite possibly in the future. Also, if you don't absorb nutrition, right, you can't strengthen cells because they rely on nutrition. Let's go to the next eye.
All right.
Hard with the photo. Or I'm sorry, we looked at the left eye already, didn't we?
Yeah, no, that was this is the left now. We were on the right earlier.
Yeah, I haven't seen this one. Okay, look at the lighting on this one. So the lighting on this one is really telling me a lot. See all that orange color around that pupil? That's not a natural hazel eye. That is chronic sulfur. Does she have any history of antibiotics as well, or something that might have sulfates in them?
Yes,
chronic candida. She might, have burning in the bowels, during detox. She might pull this sulfur out of the skin, very itchy skin during the detox. This is also a case where you might mistake a UTI when the kidneys really start filtering type of person. Let me zoom in on this one. Do you see this big, thick violet hue? So on the right side of the body, really, really poor circulation. Small bowels looking really, really clogged up. Right here. All in this area. Cerebellum, all right here showing weakness. Again, we see the radius solaris, so we know we need to get the pituitary and pineal gland.
She said antibiotics when she was younger.
Yeah, that all is just stagnant in her system because a vegan diet's not enough. I don't know how long she's been vegan, but if she's coming from a standard American diet to a vegan diet, if it's a lot of cooked foods, it's not enough to really pull this stuff out of the body. So it could remain in your system for many, many years. How's her digestion? I'm going to assume she does not have good digestion.
Yeah, she said digestive issues for sure, and then she also said very dry skin.
Yeah. I mean, look at the nerve rings in this eye. Mindy, we need to get you well, my friend. We need to get your nervous system up. We need to get your kidneys up. Uterus weakness, bladder weakness right here, where the arrow's at. Lower and mid spine, that's all this right here. Again, here's the parathyroid right there. Thymus gland weakness right there.
Yeah, she says she's been vegetarian for 5 years, vegan for a year. But even the terms vegetarian and vegan, it's need to know like what you're eating within that, because you can be on vegan junk food, you know, there's a lot of crap out there that we can eat that's still vegan, like, you know, French fries or whatever else, like it's still vegan, but those oils will get you.
Right. Right here is yeah, that's inside the bowel wall though. So I'm seeing a lot of weakness in the descending colon as well. Again, this is a person that has heavy lymph, heavy sulfur in the bowels. She's got a lot of work to do to clean out those bowels. She might also be somebody that gets really skinny on a detox, but I'm somebody that had chronic malabsorption and I was able to gain weight back, but I had to do a lot of work first in order to achieve that. I'm seeing a lacuna though right here. Here's that football, right? That oval football look. Let's map that up and see what's going on with that. So this, the left eye, let's see what that is. That's like right in the pelvis ovary. What's going on with her cycles? Heavy bleeding with the menses, heavy bleeding, you know, pain during ovulating, that sort of thing. Dryness, vaginal dryness type of stuff. Because I'm seeing left ovary weakness as well. So you've got to strengthen those ovaries so that if you want to have kids, that there won't be any complications with that. There could be possibly, I'm seeing spleen weakness, this right here, this dark line, that's the spleen. The spleen helps clean the lymph and the blood. It helps regulate, you know, pathogens and stuff in the body. We got to get that pituitary up. All right, so I'm seeing some lung. Hard to tell with the lighting, but here's some lung weakness as well.
Yeah, she said very bad vegan junk food addict at the moment. Yeah, I mean, it's
Yeah, heavy candida.
yeah, that stuff will get you. You know, I know the temptations to stay in that way, and it's comforting, and especially if you're coming from trauma and stuff like that, you know, sometimes we look for the food, but that's why John mentioned, you know, look at your environment. If there's things you can shift, it'll often help us get away from these patterns.
Right. So with all these eyes that I've looked, now seeing all of this, and then somebody that wanted to be interested in going on a regenerative detoxification path to help, you know, clean out the body, each person with some of these patterns and certain indicators that I'm seeing, they're all going to be unique, but the foundation is all going to be the same. You know, it's the 80 to 100% fruit diet with specified, you know, herbal protocol. But with somebody like her, seeing this eye, I'm going to say adrenal herbs for long-term, and also parasite deworming herbal formulas to help pull out the worms, the parasites. She might not have worms because she's not a meat eater. That's really a meat eating type of thing. But the heavy fungal loads that come in the body from like processed vegan foods, that could really turn to a lot of heavy uric acid in the body. Which could, you know, turn to arthritis, possible MS, these types of things. She definitely has the eye that sets up for like MS, you know, or small pupils too. So those small pupils could indicate central nervous system weakness. So maybe there's people in her family that have that. Always pay attention to your family history. And if you learn iridology, you could see these signs and you could stop them, you know, because we want to try to end the generational curses and get back to nature.
Yeah, exactly. Yeah. Andrew just asked, what steps did you take to gain weight after years of malabsorption? Which fruits and herbs?
Well, I wasn't intentionally trying to gain weight. My body just naturally started gaining weight as I improved my absorption and I got my adrenals working better. Once I got my adrenals working, I was able to produce, you know, more testosterone and that sort of thing, get my parathyroid so that I can get my bones denser and that sort of thing. It just naturally happened from doing cleaning, depending on how much weight I want. The only time I ever care about weight is because I'm trying to bodybuild or something. I want to put on muscle mass. So I'll eat more food. But I didn't try to force myself to gain weight. I allowed my body to naturally start gaining weight on the same diet that they had took off the weight. It takes a lot of discipline, a lot of trust to do that. Not very many people, you know, are on a spiritual journey to where they could really get their adrenals up enough to where they you know, they're not having all these fears of detox and just we have egos too, right? And we don't like the way we look, and we're vain and that sort of thing. We all struggle with that at some level. But I just eat more to gain weight now. But if before, it didn't matter how much I ate because I wasn't putting on weight because my lymph system was still really clogged up. So you really got to break down the body first and then rebuild it. That's the whole process. How can we get the body clean and alkaline first, and then we could play with rebuilding and just eat more if you want to put on weight. But don't try to force yourself to put weight on. Just allow nature to give you that body structure that it's intended to look like, and go by how you feel. What's your energy like? What's your strength like? What's your mental clarity like? Those are 3 big signs to focus on. If your mental clarity's there, your digestion's there, your strength's there, and your energy's there, who cares what your weight is? Weight's irrelevant. A lot of people they look at me and I tell them my weight and they're like, you're lying. Grab a scale. I'm very light. I'm a very light guy. Because it's not about weight, and I don't look like I'm you know, like I would look for some people that may be my weight. They look way skinnier than me. So I've learned over time, don't go by what your weight is, what your BMI is. This is all programming by the system, and let your body teach you how it should function. And I can guarantee you, when you reach these higher levels on the fruitarian path, you'll understand what's acidic, what's mucus forming, and you'll also reach those levels of mental clarity that you've never been able to experience prior.
Awesome. Yeah. Yeah. I don't know if we want to get into a full-on Q&A after all that. I know you've got to run.
Yeah, I actually do have to go now. It's 11:11. Good time to end it.
Yeah. Yeah. So thanks, brother, for being here. And like I said, show some love to Jon for the work that he's put in here and the information that's being shared. All his information is in the show notes. If you want to get a full on iridology reading, consultation, all of that good stuff, I'd highly recommend it. But even if you just want to send a little bit of financial support, just to say thanks for this show, that's always appreciated too. And like I always say in my calls, if you can't pay financially, you know, no worries. Just make sure to honor this energetic exchange and pay it forward somewhere or another. And that's how we change this world. So yeah, brother, thank you so much for being here, and looking forward to the next one.
Sounds
Do
good, bro.
you have any closing words or anything you want to say before we sign off?
I could end it with my with how I end my YouTube videos.
Yeah, go for it.
All right, so get back to nature, my friends. Get back to the diet you're biologically designed to eat. Tap into your intuitive consciousness. Let your instincts guide you. Live in the present moment, and I promise you, my friends, you'll thrive. Aloha, namaste, peace be with you.
Awesome. Love you guys. Y'all take care.
All right, see you. Thanks for having me.